we think of data, especially here in BC where it's so diverse with various First Nations and language groups and cultures?
It's critically important that we actually engage with communities to get their perspectives on how to govern information and data in the future and how that's going to inform improvements in health and well-being.
We're really working towards reframing the narrative from sickness to a model of wellness and defining those indicators for ourselves.
Transforming to health and wellness from sickness, it really does require a difference in the data and the information we collect. It's quite easy to collect statistics that relate to morbidity and mortality. It's pretty obvious when somebody's dead or really sick, but it's not so obvious when we have a concept of well-being in front of us. It requires us to actually do a different kind of analysis and to collect different kinds of data.
What kinds of questions are we asking? Are those questions and the results that come out of the research and the evaluations, giving us some blueprint to a better future?
We look at research projects and surveys and data, and how can it reflect our traditional values? How can it reflect our cultures? How can it reflect our oral history? And also be translated into health models of wellness that make sense for our communities.
So we're just in the very beginning stages of identifying what is wellness in the First Nations perspective, and then what data do we need to collect to be informed as we move forward.
The FNHA has a certain capacity and mandates within the construct of our relationship with our customer owner, but we need to be very clear as to how we would, on their behalf, manage their identity and support that relationship with the regional health authorities, with the Ministry of Health, with the federal government, and so on and so forth. I think that trust needs to be earned, and we need to do a really good job in doing that.
To do transformation appropriately and in a way that really resonates with First Nations people, we need better information. The information that has been collected on First Nations over time hasn't necessarily been owned by First Nations, much less a provincial body to steward and have custodianship over that information.
There's a huge discussion around ethics in research, and with data governance involved in that, I think it's now focused on not just collecting data for the sake of collecting data. It's really looking at creating change and also working with different groups within the community and involving them in the process.
First Nations Health Authority has been given a strong mandate to conduct research and analysis to improve programs and services as a partner to increase health and wellness for First Nations people in BC. However, if you work in research or if you live in a First Nations community, chances are that you've heard the term First Nations people have been researched to death. And that's the feeling, due to a long history of unethical research, of external researchers coming into communities and doing what I call the data and dash, what other people have called the smash and grab, and taking what information they needed for knowledge generation purposes, other agendas, publish or perish timelines, and communities never hearing from them again. But an elder at the Royal Commission for Aboriginal People in Canada said, if we've been researched to death, maybe it's time we started researching ourselves back to life. And that's the future of this work that the First Nations Health Authority is conducting. It's about research by First Nations for First Nations, where First Nations have decision-making and control over the entire research process, from the agreement that's created to the knowledge dissemination, exchange, and enacting that information into policy and procedure. Research and good research ethics are based in good relationships. And so our activities at these data governance forums throughout the province has been about articulating the regional values that are going to be placed on our research ethics work. Values that tell us how we want to provide support and protection for research participants.
There really needs to be a shift in the decision-making process from Ottawa-based bureaucrats and politicians to actually local community governance of their own affairs. That's where long-term healing will take place. People taking control of and ownership of their own future. And that's what self-determination is about. When data depicts people as being disorganized, out of control, in a state of chaos, it undermines their legitimate aspirations to control their own affairs. Social theorists have known for some time that if you improve people's access to information, if you give people resources, they will use those resources to improve their well-being.
Data is one of the most important things that we need for our leadership, our decision makers, our families, to know what the evidence says about needs. And so data helps inform that And without good data, we can't make those good decisions, informed decisions, and understanding how everything is connected to one another, so that the importance of housing, the importance of job security, the importance of a good quality education, all of these things together help us get stronger and healthier.
I learned that our people are resilient. I learned that we are full of solutions, and this session has provided a great opportunity to engage with community members and leadership in terms of how to create better health programs, policies. And
these are really big topics that we're talking about, and it's really important for people to see that everyone can contribute, everyone needs to contribute, and that everyone has a role. And by working together and collaborating, that the sooner we do that, the quicker the results we'll see in our families and our children and our communities.
I hope that the community leaders and the First Nations Health Authority both take away confidence knowing that there's a beginning of a really secure partnership emerging, that we do have to work together moving forward, and that people are being heard.
So it's a health system for us, by us, and we're working towards what that looks like, and we're getting a lot of solutions and ideas.
Basically, it's a bit of a game changer in terms of First Nations health in the province. This is a great opportunity for us to actually reflect on how does community become engaged in the health information, the governance of data, and I think it could be a model for other areas beyond the health area.
Community members are talking about looking outside the box and, not to just look at health as one isolated thing, but how the land is connected to our health, how all these other pieces are connected, and that we can't work in isolation of each other. We have to work together for a healthy model to create healthy communities.
I think we have to ensure that we're talking about transformation of health and wellness in the long term. So the better we are prepared to take a journey of accessing and controlling First Nations information under our own rules and guidelines, the better we're able to map out what we need from a service perspective and transform how programs and services are delivered on the ground. And we're providing very much a leadership role in the province and in the country when it comes to that.
There really isn't another example of Indigenous peoples in a governed process by Indigenous people and for Indigenous people that creates policy that gets implemented towards improving the health. It's a big challenge. We need to work together. We need to support one another in imagining a better future for children and our communities.
This is really about governance. It's about governance, community development, and nation rebuilding. And all data is the information we need to tell our stories as First Nations people in our own words.